Friends, knee replacement is one of the most successful surgeries of the century. Now, a person who's crippled, who's unable to get out of his wheelchair, who's unable to go to the toilet, who's unable to do anything of his own without any support, because of knee pain, can be easily relieved and can be cured of his problem with this simple, straightforward surgery called knee replacement. Total knee replacement involves changing the surface of your knee joint. Now, the knee joint basically has two surfaces. One is the thigh bone, another is the leg bone. Now, these two surfaces are completely worn out in case of osteoarthritis of the knee. In patients with osteoarthritis, the bone rubs on the bare bone. Now, the bone has free nerve endings, which means nerves touch each other and every step they take is extremely painful. So they are unable to walk, they are unable to climb the stairs, they are unable to do anything they enjoy doing. At the age of 50 or 60, you enjoy outdoors, you want to go to a temple, you want to attend some family functions, some social gatherings. Your knee is stopping you from doing all these. Now, there is a wonderful solution for this that is called knee replacement surgery. Now, every patient with osteoarthritis, does he need surgery? No, absolutely not. It's definitely not every patient needs surgery. Most of the patients, almost 90% of the patients, can be treated with efficient and good physiotherapy. Now, exercises can actually increase the strength of your muscles and improve the mobility of your joint. Thereby, in a case of a mild wear and tear, you can easily get by with physiotherapy and some supplements. Very rarely, in case of acute pain, we give injections in the knee. Now, if the exercises and injections haven't worked and your arthritis has progressed, with progression of osteoarthritis, what happens is your knee gets bent. It usually gets bent outside or inside. We call it as varus or valgus. Now, when such a knee bending happens, your axis of weight bearing actually changes. Your weight bearing is not going through a straight line. Your knee is bent. So every step you take, the knee is bending more and more. So once deformity occurs, once there is a bend in the knee, the bend progresses, the deformity progresses, thereby leading to more pain and disability. Now, you consult a doctor and he says you got a bad deformity, your knees are bent badly, then probably the best treatment for you is total knee replacement. The surgery basically involves changing the surfaces, as I mentioned you. Now, technology has improved so much that the surfaces can be very easily replaced by simple instruments, and the implants are extremely good quality nowadays. We get titanium implants, we get oxenium or cobalt chrome implants, which have a very long life. Now, usually we say the implants last for 30 to 35 years inside your knee. So if you get the surgery at 60, easily up to 95, your knees will be good. So which means this is a one-time surgery for you. So this surgery involves stay in the hospital for a couple of days usually. We usually make the patient walk the same day or the next day. So by 24 to 48 hours, the patient is up and about and he goes home. So as you go home, I've seen a lot of patients actually doing their own household work even on the 6th or the 7th day. But the usual time frame we give is about 2 weeks to 1 month. So within a month, the patient recovers completely, walks around comfortably. There will be some residual pain and the pain gets better slowly with exercises and some medication. But by around 6 months, it's a forgotten joint. You no more remember that you had a surgery and you had the pain. And knee replacement patients are some of the happiest patients we see because their knee is straight now, they're able to walk, they're able to climb stairs, they're able to do all the activity they enjoy doing. Some of them even play social sports. So this is a surgery worth considering in case of completely worn out knees. But if your knee is in the early stage of arthritis, there is a good chance that you might need only physiotherapy. If you have any doubts or comments, please post us. Best wishes for speedy recovery.